Hey, healthcare heroes! Did you know that nearly 80% of serious medical errors involve miscommunication during patient handoffs? Every shift change is an opportunity to ensure patient safety, or put it at risk. A rushed or unclear handover can lead to medication errors, missed symptoms, and even life-threatening complications. So today, we're breaking down why shift handovers matter, how to use the SBAR method for safe and clear reporting, and the most common mistakes to avoid. Let's dive in. Shift handovers aren't just routine. They're critical moments that directly impact patient care. What happens when handoffs go wrong? Vital patient info gets lost or misinterpreted, delays in treatment, and poor clinical decisions, and increased risk of medication errors and adverse events. But here's the good news. By following a structured approach like SBAR, we can ensure safe, efficient, and clear communication. Let's break it down. First, use SBAR for effective shift reports. SBAR is a simple, structured method that keeps handovers concise, accurate, and easy to follow. SBAR stands for Situation. What's happening right now? Background. What's the relevant patient history? Assessment. What are the current concerns? Recommendation. What needs to be done next? Example. Instead of a vague handoff like patient is doing okay, no issues, try Mr. Jones, 68, admitted for pneumonia, had a fever spike overnight. We started IV antibiotics. Vitals are stable, but he needs oxygen monitoring. Let's reassess in 2 hours. Clear, focused, actionable. Second, avoid common shift handover mistakes. Even experienced healthcare teams make critical mistakes during shift changes. The most common errors and how to avoid them. Incomplete handovers. Always include key vitals, medications, and pending tests. Assumptions and vague language. Be specific. Don't say patient is fine. Explain what's stable and what still needs attention. Distractions during handoff. Find a quiet place to avoid miscommunication. Or better yet, do it by the bedside so the current status of the patient can be visibly seen and assessed. Example of a poor handover. Yeah, Mrs. Lee had a rough night, but she seems better now. Just keep an eye on her. Better version. Mrs. Lee, 75, post-op day 2, had pain spikes overnight. Given PRN meds, but still needs pain assessment every 4 hours. Also, monitor for signs of infection. Precision matters. Third, use real-time documentation and team collaboration. Great shift handovers aren't just about verbal reports. Proper documentation and teamwork are essential. How to improve handovers through documentation. Chart key updates before your shift ends. Don't leave it to memory. Use checklists to ensure nothing is missed. Encourage two-way communication. Allow time for questions. Example. Instead of dumping last-minute details at the door, briefly walk the oncoming nurse through key concerns and check that they understand the next steps. A well-prepared team equals safer patient care. See? Mastering shift handovers isn't just about passing information. It's about protecting your patients and supporting your team. By using SBAR, avoiding common mistakes, and improving documentation, we can prevent medical errors and ensure smooth, safe transitions of care. Have you ever experienced a great or terrible shift handover? Share your story in the comments below. If this video helped you, hit that thumbs up, subscribe for more patient safety tips, and share this with your colleagues. Let's make shift handovers clear, safe, and effective together. And remember, better handovers equal better patient care.